Hi everyone and welcome to my channel. My name is Hadeel.Khaldi and today inshallah we are going to talk about the urinary tract infection UTI. Urinary tract infection, it is an infection in any part of the urinary system. The urinary system includes the kidneys, ureters, bladders and urethra. Most infections involves the lower urinary tract, the bladder and urethra. Women are at greater risk of developing a UTI than are men. If an infection is limited to the bladder, it can be painful and annoying, but serious health problems can result if a UTI spreads to the kidneys. Healthcare providers often treat urinary tract infections with antibiotics. You can also take steps to lower the chance of getting a UTI in the first place. Now the next point is the symptoms of UTIs. UTIs don't always cause symptoms. When they do, they may include 1. A strong urge to urinate that doesn't go away. 2. A burning feeling when urinating. 3. Urinating often and passing small amounts of urine. 4. Urine that looks cloudy. 5. Urine that appears red, bright pink or cola-colored, signs of blood in the urine. Strong smelling urine, pelvic pain in women, especially in the center of the pelvis and around the area of the pubic bone. And in older adults, UTIs may be overlooked or mistaken for other conditions. What are the risk factors for UTI? UTIs are common in women, and many women experience more than one UTI during their lifetime. Risk factors for UTIs that are specific to women include: the first one is female anatomy. Women have a shorter urethra than men do. As a result, there's less distance for bacteria to travel to reach the bladder. The second one is sexual activity. Being sexually active tends to lead to more UTIs. Having a new sexual partner also increases risk. The third one is certain types of birth control. Using diaphragms for birth control may increase the risk of UTIs. Using spermicidal agents also can increase risk. And the other risk factors of UTIs: urinary tract problems. Babies born with problems with their urinary tracts may have trouble urinating. Urine can pick up in the urethra, which can cause UTIs. Blockages in the urinary tract, kidney stones, or an enlarged prostate can trap urine in the bladder. As a result, risk of UTIs is higher. The third one is suppressed immune system. Diabetes and other disease can impair the immune system, the body's defense against germs. This can increase the risk of UTIs. And the last one is catheter use. People who can't urinate on their own often must use a tube called a catheter to urinate. Using a catheter increases the risk of UTIs. Catheters may be used by people who are in the hospital. They may also be used by people who have neurological problems that make it difficult to control urination. Now, what are the complications of UTIs? UTI, when treated properly, lower urinary tract infections rarely lead to complications, but left untreated, UTIs can cause serious health problems. The problems are: 1. Repeated infections, which means you have 2 or more UTIs within 6 months or 3 or more within a year. Women are especially prone or having repeated infections. The second one is permanent kidney damage from a kidney infection due to an untreated UTI. The third one is delivering a low birth weight or premature infant when a UTI occurs during pregnancy. The fourth one is a narrowed urethra in men from having repeated infections of the urethra. And the last one is a sepsis. A potentially life-threatening complication of an infection. This is a risk especially if the infection travels up the urinary tract to the kidneys. And you must know how to prevent getting UTI by doing the following. 1. Urinate after sexual activity. Stay well hydrated. Take showers instead of bath. Minimize douching, sprays, or powders in the genital area. 5. Teach girls when potty training to wipe front to back. And you should know how to treat UTI by doing the following. 1. Asking about symptoms, doing a physical exam, ordering urine tests if needed. 4. Take antibiotics exactly as your healthcare professional tells you. Finally, thank you for listening. Please don't forget to like and share the video, and see you in other videos.